Welcome to Atrium Health Navicent Knows Health. I'm Cindy Busby and I'm here today with Dr. Misti Patel. She's a maternal fetal medicine specialist, and today we're going to talk about her practice in Central Georgia. Dr. Patel, thanks so much for being with me.
Thank you for having me.
Would you let our audience know a little bit about what is the specialty maternal fetal medicine?
Maternal fetal medicine is often referred to as high-risk obstetrics. So our job is to take care of mothers and babies who have complications of any kind.
Mm-hmm. And when in a woman's pregnancy, or maybe even before her pregnancy, would she possibly come in contact with your specialty?
Sure. We often can see patients pre-conception if they know that their history is complicated by things like high blood pressure or diabetes or a known genetic syndrome in the family. We often can come into contact with patients as well, early in the second trimester of pregnancy when we're doing genetic screening and genetic counseling as well. And we see patients at around the 18 to 20 week mark where we do most of our ultrasounds to look for fetal structural abnormalities.
Do you find that most of your patients here are primary new patients to you, or do you tend to see certain patients who come back maybe during their second pregnancy?
I think it's a really good mixture of patients who come to us for the first time being referred from a lot of areas outside of Macon. And we are very fortunate to get to see a lot of repeat patients and help them through multiple pregnancies. It's really gratifying to get to do that.
When you talk about seeing patients outside of Macon, so in the region, do you do many of those in person, or is that something that's done more virtually through virtual health today?
All of our visits are done in person, and so we're very fortunate to get to both do ultrasound and patient counseling in our office.
Tell us a little bit about some of those diagnostics, like ultrasound that you've mentioned. What are some common diagnostics that are done by your specialty?
Right, so I think the most common diagnostic that we use in our specialty, like you were saying, is what we call the level 2 ultrasound. And I often explain that to patients and say it's a very detailed ultrasound where we look in a really detailed fashion at baby's anatomy. So brain development, heart development, all the organs in the belly, the bones of the arms and legs, so that we can determine whether we think baby structurally is developing the way that we would expect. We also do diagnostic testing, like you were saying, for any genetic issues that we may be concerned about. So things like amniocentesis, or even some of the newer blood work that helps us screen for genetic conditions.
How does a patient know when it's time to be referred to you, when they're working with their primary GYN? How are they told, or how do they know to do that?
So again, like you said, it's a decision that's made with a patient and their primary OB. It's kind of a joint decision that they make. We're very fortunate in that a lot of the OBs that we work with are very capable in handling higher risk patients as well. But we're always here to help, again, manage maternal complications, diabetes, high blood pressure, if those are very difficult to control, especially in the pregnancy period, or if a patient has an ultrasound with their primary OB and there's something that they want us to take a look at or something that they're concerned about, then that's a really good time for them to come to us.
So you could take care of both the fetal development, but also if women who are pregnant have maternal conditions,
yes,
you would also do that monitoring.
Yes.
So it's
Yes.
not just about it, and you can treat them both then separately.
Correct. So I think that's one of the really great things about our field is it is maternal fetal medicine, and so we take care of moms in their unique situations, and we part of our job is to try to understand how what's going on with mom affects baby and vice versa, so that we can understand. It's a complicated interplay that you see in pregnancy between mom and baby and the physiology, and so that's probably one of my favorite parts of my job is getting to work with that.
Tell us a little bit about genetic screening, when it might happen for a family, when they find out they're having a baby, or maybe before or after they have plans to get pregnant.
Yeah, so I think that genetic screening, both for mom and for baby, has come a long way recently. So even before a mom gets pregnant, she may be offered something that we're doing now called carrier screening. So there are really good tests now to look at a variety of what we call autosomal recessive conditions that may run in family and that mom may be a carrier for. And so that could certainly be pertinent, even before a mom gets pregnant. And then also starting in about 10 weeks of gestation, we're able to offer blood work screening for some of the most common genetic conditions that baby might be affected with, in particular things like Down syndrome, trisomy 13, and trisomy 18.
Of all the specialties that you could have selected, you were first an OBGYN and then became fellowship trained in maternal fetal medicine. Why did you pick MFM as your specialty?
I love ultrasound. I love the physiology of pregnancy. Pregnancy is such a unique and special time in a mom's life. And I love helping women navigate kind of the complexities of pregnancy, and certainly supporting women through more complicated pregnancies that might not have been what they were always, planning for their pregnancy. The patients are really my favorite part of my job and why I chose this.
If a patient who's watching maybe sees themselves or someone they know in the conditions you've described, how would they go about getting access to your specialty? What's the best path?
Sure. I think the best path is to have a conversation with your primary general OB, so the person that you see early in pregnancy or during the preconception period, and have a discussion about these are my concerns in pregnancy, and could we maybe together work with a specialist to give me the best pregnancy outcome that I could have.
Well, thank you so much for telling us so much about your practice.
Thank you. It was such a pleasure. Nice to meet you.
Thank you. And thank you for joining us at Atrium Health Navicent Knows Health. If you'd like to know more about Dr. Patel and her practice, please visit us at atriumhealthnavicent.org.